Well, everybody, this is Bonnie from Billing Buddies. Jordan, our coordinator, is also in the background, controlling all the questions in the scenes as I'm speaking. Thank you for attending our webinar. And the important thing for you to know is on that chat bar on the gray panel, it's probably the right side of your computer unless you moved it. That's where you would type your questions in. So please feel free to type those and I'll get in there. I have one question that was waiting that I'm going to go over first, and then I'll go through whatever questions you have. And besides that, the topic I want to start out with is a really hot topic for me, and I want to communicate it all to you. And maybe as I'm doing that, you'll think of some other questions to ask too. So the important item is for you in your practice, when you're charging people, there's a law by the OIG, the Office of Inspector General, and they oversee the Centers for Medicare and Medicaid Services. I consider them the IRS kind of billing, the OIG, and they have a uniform pricing policy in which clinics need to charge uniformly. And it sounds really simple, but it gets complicated. And how it gets complicated is, first of all, you can charge time of service discounts. And so that puts a snag in it. And that makes perfect sense that if either the patient or the insurance company pay at the time of service, they can get a percentage off. The recommended, they said, is 15% or less off the charges. Otherwise, it's considered an inducement. Where that's kind of tricky about charging uniformly is if you have a patient who's in the past paid the time of service discount at the time of service, so you're not carrying a balance, and say their credit card doesn't clear, or say they forgot their checkbook, or maybe they're not going to get paid till Friday. Well, now they're not paying at the time of service, so they did not earn that discount, and you're carrying a balance. How I've seen insurance companies become entitled to that balance is there may be a car accident and they know a person's going to come at least for the next dozen visits, and they might prepay the dozen visits, and then you're again not incurring the cost of waiting for that money, which is very valuable to get paid at the time of service, or the paperwork part of it. So I caution you that if you are doing time of service discounts, you can only do that if indeed they pay at the time of service. The other scenario with uniform pricing that's important to know is there is times when patients might qualify for hardship discounts. And when there's a hardship, you're allowed to give a discount, but you need to follow a plan to do that. You can't willy-nilly think one person deserves the discount, whereas you might think another person doesn't. And how you can assure that you're being uniform with your hardship policy is, in fact, to have a hardship policy. And what it has to contain is, first, a way to calculate what the discount is. I'll give you an example. You can make the policy up to fit your practice, but you have to have the policy. An example would be you determine the federal poverty guideline, and after I can show you this after I go to the web. They change it the first of each year, the government does, and you can establish if someone is 200% or less of the federal poverty guideline, you're going to give them a 50% discount. Now, again, this is all subjective on what your clinic determines. The next thing after determining the discount you're going to give, the next important part of the hardship policy is establishing how you're going to determine income. And you're going to do that, again, uniformly for the people that apply for this hardship discount for your practice. And how you're going to do that is you're going to say, I need 3 months of a bank statement, or I need the last 2 years of tax returns. Maybe you're going to go by pay stubs. Whatever it is, as long as you have a policy, you're good, and you're following the guideline, and you're making a good faith effort to collect that money, and write off the money wherever it's appropriate. The one question that I received, I apologize, we did receive a voice message on our phone system, and we lost that message. We heard it, and when we went to replay it, we hit delete instead. And I think there's a gal out there named Janie. If you could type your question in the chat box on the bottom of the control panel that's open for the GoToWebinar. The question I received by email was, what do you do with the 7th digit when it's an accident code? You either do A for active treatment, D for maintenance, or S for sequela. And when I'm going to just happen to open up my CMS's guidelines too. Prior, our company, everyone in our company is certified medical reimbursement specialists. That's what the CMRS after our name stands for. And we need to maintain each year continuing ed credits. And we can do that in a number of ways. One way is to go to the national conference in Vegas in October. And when I was there this year, I had been studying up prior to going there with a lot of different chiropractic issues, this being a big one. And I'll show you the Medicare policy as well. And A, from everything I had experienced, meant active treatment, just like the AT modifier meant. And I'd found it from a third party, but I had not found it from a primary source that governs the rules. And so I went prepared to go to the coding webinars and ask this question: what do you do about the 7th digit? Because I see a lot of times it's initial, only the first visit. And I see sometimes that it is the active treatment for chiropractic. So during the webinar, there's certified professional coders. I don't know if you're familiar with that, but they have, I believe it's a 4-year degree just in coding. I'm a chiropractic professional coder, which is training in a test that to maintain, but it isn't near what a CPC, a certified professional coder, is. So I'm listening to a speaker, and they're saying it's only the initial visit, only that you put the A on. And I'm worried, if as chiropractic specialty, if we only put an A on the first one, is that going to mean maintenance? So I raised my hand, and the speaker said, no, the A only means the initial visit. And I said, well, how? I wonder how. I was kind of confused. And within about 3 or 4 minutes, someone from the audience took the book. This coder was not familiar with chiropractic specialty, and it's an ICD manual put out by Optum 360. And right in the beginning, it says, if it's a chiropractic visit, the A means active treatment and should be used as long as the person's in active treatment. And active treatment, goes with your treatment plan, of course. And so as you're establishing your goals and outcomes, as long as you're showing that person's progressing and going through active treatment, you use an A. I would caution you, as soon as you use the D for the subsequent visit or maintenance visit for chiropractic, it's the same as putting a GA modifier on a claim for chiropractic. and I don't know, any of you have attended any of my webinars. I always use the phrase, I like to go to the horse's mouth. I'm always reading lots and lots of literature. And when I see something, I always go through and I try to substantiate it with CMS. And CMS.gov, which is Centers for Medicare and Medicaid Services, I always called Medicare the godfather of billing because they established the correct coding initiative. But I Googled, I searched the seventh digit, and these are the top hits. I see down here where it talks about initial encounter, and I don't know what any of these said. I'm just going to take a brief look at one. But the question then, I actually bought one of those books, the Optum 360, at that seminar to have more material to read. I'm going to see here if we have any. Won't make you dizzy, I promise. I'll go slow. If we have any definitions just for the A and see what we can find. I'm going to seventh digit here. Use additional code. And then if we looked at Medicare's policy, in there, remember in the old policy, if the code started with an 8 or a 9 or an ICD-9 days, that meant it was an accident. Well, of course, Medicare, if they, or anybody, any payer thinks there's an accident, they're going to duck out right away. So that was always concerning to ever use an 8 or a 9. Here we go. What you can do is there's a select number of Medicare codes, the seventh digit, that you're allowed to use in the starting with an S or a T. So rather than an 8 or a 9 in ICD-9, it's an S or a T in ICD-10. I'm just going to go a little bit further, and then I think I'll see if there's any questions. Here is exactly what I wanted from Medicare. As long as the patient is receiving active treatment for the condition, the seventh digit can be coded in initial encounter. That's exactly what we want. If you want a copy of this, I can email it to you. I might be able to just save it here. You know what? I'm going to reach out. Okay, I'm going to save this. Now, in the right panel of right by the chat, I'm going to upload a file that you all have access to. So if you want this in writing from the Godfather, you can take a copy of it, and it should be going. It says it's there now. So you now on the right above the chat button, there's a handout button. You should be able to see what you need to see for that initial encounter. Code that as active treatment. Okay, and I'm going to just take a peek and see, do self-funded insurance have special privileges? That's a yes and a no. There's certain laws called the ERISA laws. I don't know if you're familiar with ERISA, but it's employment related. I don't know the whole acronym, but they have special guidelines where they have to follow prompt payment. And if you can get, it's called an SPD, summary plan description, from the self-insured plan, And for example, in the summary plan description says it'll pay for 30 chiropractic visits, then yes, then uh, that's an example where you can appeal that through federal ERISA laws. It's very effective, very, very effective. It's spelled ERISA. If you want to look into that on the web, there's special privileges there. The other thing is self-funded plans, of course, because they're following them. They're creating their plan, I should say. They can create their plan provisions and what's going to be covered or not covered. There are certain guidelines in the government with like mental health, for example, that are mandated to be covered. There's certain things that have to be covered as an essential health benefit. But other than that, they work as much as the same as other plans. And so you have your essential health benefits of what has to be in there, and your ERISA appeal right, which needs to be in there. We are, just so you know, we are going to do another upcoming ICD-10 webinar. We had some demand for that after the fact that people weren't able to attend in that month of September. So watch for that if you want to attend. Next Tuesday, we're having that at the same time at noon. And what I'm going to be going through is the Medicare local coverage determination. First of all, how to find it for your area. This is huge. Every area is different. I didn't know that until actually comparing them side by side. For example, Florida pays $98943, the extremity adjustment, whereas I'm in Minnesota, they don't. The same with some of the cover diagnosis. They'll be paid. The cover diagnosis aren't uniform across all the states. So I'm going to go through that in our webinar, and I'm going to go through like the 7th digit and how that affects not only Medicare, but work comp and auto in those payers. And so watch for that to come. Another webinar we're having, and these we're going to keep having free webinars every couple weeks. And so if you have questions and you want to get them answered, put them out there. It'll help your colleagues and everybody get their questions answered. But another upcoming webinar that we're going to have is a practice follow-up policy for better cash flow. Many practices don't have a solid foundation on how they're going to do their follow-up policy, as long as charging too. I was looking at item 3. But what's very helpful is to identify a plan for the different prospects that could come in your clinic, whether they're self-pay, a contract insurance who you have a contract with, or a non-contract, which there's literally 6,500 electronic payers at Office Ally, which we happen to use, that fall into the non-contract, which changes how it's going to, how the obligation is. Because if the doctor doesn't have a contract with the insurance, that changes the whole dynamics of collecting a bill. So we're going to have a webinar on that, defining practice follow-up policies for better cash flow. And then I'm going to come through with another webinar going through in detail the uniform billing practices that are required by the OIG. And rather than just spouting out what the rules are, I actually go to, like I just did with the CMS, go to the guidelines, and so you can actually see the law and have it in your hands. Many people will call me and say, well, the chiropractor down the street, they give, this package deal, or they give this, or they, the different things. And I thought that was okay. And it's not, when I do webinars, it's not what I think is okay. It's what the actual rules are. Um, so we're coming down here for the last few minutes. Please, anybody who has a question, feel free to type that in the chat box. The chat box, if you close that gray toolbar that popped up when you logged in to the webinar, there's an orange arrow. If you point to it, it'll expand that chat box or expand the control panel, and you can see both the chat box to ask your questions. Also, you'll be able to see the handouts there. And I see Janie said I answered her question. Very good. I was concerned about missing that one. I'm happy we got that in. So if there's anything you have, I'm going to give it another minute here and see if anyone asks. Otherwise, we wish you all a very happy Thanksgiving, and thank you for all who attended. And we look forward to our next webinar that we're going to do on ICD-10 next Tuesday, and also the free question and answer time. And with that, I'm going to be signing off. You all have a great day and a great Thanksgiving. You take care. Bye-bye.